Tonight, my hope is that you leave seeing weight a little differently, not as something to be ashamed of, but as something we can actually understand and work towards having a healthier life. My goal is to focus on lifestyle changes you can actually adopt, small real shifts that add up to meaningful changes and how you feel and how your body responds. Discussing medications and surgical options in depth is beyond the scope of tonight's talk, but I'm happy to point you in the right direction after. We will have time for Q&A, as Shraddha mentioned at the end, so hold your questions and stay with us. I promise it'll be worth it. Everything I share tonight comes from peer-reviewed research and from 8 years as a hospital physician, but nothing here is meant to diagnose you, alarm you, or pressure you about your body. If you leave tonight with just a little more understanding of yourself, that's enough. My goal is to give you a language for conversations with your doctor, your family, and yourself. If anything I say tonight sounds like your story, please talk to your physician. I can give you a map, but I can't replace the person who knows your full history. A little bit about me. I'm Dr. Shilpa Kalli, a board-certified internal medicine and obesity medicine doctor. 8 years of working as a hospital physician taught me one harsh truth. Our healthcare system is incredibly good at treating illness, but not so good at preventing it. As a hospitalist across New Jersey and Delaware, I cared for patients with diagnoses that filled pages, from diabetes to heart attacks to strokes, liver failure, kidney failure, depression, etc. Most of them were taking at least 5 to 10 medications, and each pill was treating a separate condition. But all of them shared the exact same root cause. During those years, I was also an assistant professor of medicine, and my job was to teach medical students from Drexel College of Medicine and PCOM how to think through clinical complexities of inpatient care and how to see the whole patient, not just the chart. But something kept bothering me. The same patients kept coming back. We treat them, discharge them, and weeks later, they were back in the ER. Excuse me. We were masterful at fighting fires, but we were not doing absolutely nothing to stop the conditions that started them in the first place. The engine driving almost every single one of these fires was obesity. Yet the system wasn't treating it like a chronic condition it actually is. That realization is exactly why I started Renovance Health. Treating obesity isn't about chasing a lower number on the scale. It's about giving the human body a chance to reset, to heal, and to prevent chronic diseases waiting to follow. To give you some perspective on why this kind of care is so hard, there are fewer than 12,000 board-certified obesity medicine doctors in the US and Canada, and I'm deeply grateful to be one of them and to have the privilege to treat my patients to prevent chronic illnesses and to have them reclaim a better quality of life. So here's our roadmap for tonight. First, we flip the script on how you think about your weight. Then we go under the hood to see what's actually happening in your body hormonally and biologically that makes weight so much harder to lose. We will look at what happens when it goes untreated. Not to scare you, but because understanding these stakes is a part of understanding the disease. Then comes the hopeful part, the full toolkit we have today, from lifestyle changes to medications to surgeries. And finally, we will close with real practical changes you can start tomorrow morning. Here's the single most important thing I want you to leave with tonight. Obesity is a disease, not a character flaw, not laziness, a disease in the exact same category as blood pressure or diabetes. Think about the word dis-ease, a body that's not at ease. When someone's blood pressure is high, we don't say they failed at relaxing hard enough. We treat it. Obesity works the same way. Your body has a natural system to keep itself in balance, like temperature, blood sugar, weight. In obesity, that system becomes disrupted and genuinely cannot restore itself without help. And that's biology. But here's the massive hope in that data. A 5 to 10% weight loss is all it takes to meaningfully reduce your obesity-related complications. For someone who is pre-diabetic, just losing 10% of their weight cuts the risk of developing full diabetes by 90%. You don't need a total transformation tomorrow. You just need a start. Now let's talk about how we measure this, because you've probably heard the word BMI, body mass index, your whole life. BMI is simply a number calculated from your height and weight. Under 18.5 is underweight, 18.5 BMI to 24.9 is normal, 25 to 29.9 is overweight. Obesity starts at 30, broken into three levels of severity, as you can see in the screen, and the class 3 obesity is over 40 BMI. But here's something I want everyone in this room to hear. The thresholds are different for Asian population. Overweight starts at BMI of 23, not 25. Obesity starts at 25, not 30. That's not a footnote. It means many people in this room could be carrying a significant health risk at a number their doctor might call normal or standard chart. Why? At the same BMI, complications from obesity like diabetes mellitus, hypertension, hyperlipidemia, or high cholesterol, heart disease, or strokes can happen at a much lower BMI compared to other ethnicities. One more number worth looking at is over 40% of US adults have obesity. Add overweight, where over 72% of population carrying excess weight. If you have struggled with your weight before, you're not alone. I want to show you why losing weight is so much harder than people think and why it's not your fault. Let me tell you about a study that genuinely changed how I thought about weight loss. It followed contestants from the Big Loser TV show years after the show ended. You'd think once they lost the weight, their metabolism would return to normal. It didn't. 6 years later, their bodies were still burning 500 fewer calories a day than expected for their size every single day for years. Think about that. 500 calories, that's nearly a full meal permanently subtracted from what your body burns just because you lost weight. There is a name for this: metabolic adaptation. Your body has something like a thermostat, a set point it defends when you lose weight. It doesn't accept the new number. It turns down your calorie burn, turns up your hunger hormones to pull you back to the set point. And that's not failure, that's evolution. Your ancestors who survived the famines were the ones whose body fought the hardest to hold on to fat. And the hormones made it even harder. After weight loss, your hunger hormones like ghrelin go up. Your weight loss hormones like GLP-1s goes down. Your brain is receiving a constant chemical signals to eat more while you're trying to eat less. So next time someone says just use more willpower, remember this slide. You're not fighting a lack of discipline, you're fighting your biology that's working exactly how it was designed to. So if it isn't willpower, what is it? Honestly, it's almost never just one thing. I think of obesity like a six-piece puzzle, and every single puzzle looks entirely different. First piece, hormones and metabolism. Things like insulin resistance, PCOS, which is now called PMOS, thyroid issues, or metabolic slowdown from aging and menopause can all contribute to weight gain. Second piece, brain signals. Sometimes the chemical that I am full message from your gut doesn't go to your brain the way it should. The third piece is mental health. Conditions like depression, anxiety, eating disorders like bulimia, and night eating disorders or binge eating disorders, they all add up. And fourth piece is the medications. This surprises people. Certain medications like antidepressants, steroids, and even common blood pressure medications like metoprolol can drive weight gain as a side effect. Fifth piece of puzzle is genetics and environment. I'm going to discuss about this later in the slides. And social and economic factors. What food is actually affordable and accessible to you? This is exactly why the first thing we do with a patient is a deep, comprehensive intake. We have a map out which specific pieces are active for you, because trying to treat the wrong piece will never move the needle. There is one more crucial medical fact worth noting. Fat tissue is not just inert storage, it's an active endocrine organ which secretes a lot of inflammatory mediators, which causes chronic inflammation and which leads to several other consequences, which we will be discussing later. Now, the most common word that you might have heard in internet or social media is insulin resistance. And why? Because this is the most common cause of weight gain. Let's look at the hood, at one major chemical reaction that changes everything: insulin resistance. Think of insulin like a tiny key. Its job is to unlock your body's cells so the sugar from your food can get inside the cell and give you energy. But with insulin resistance, that lock on your cells are jammed. The key won't turn. Because of that, sugar gets trapped in your blood. Your cells are starving for energy from inside, while while your blood sugar keeps rising. To fix this, your pancreas panics and pumps out massive wave of extra insulin to force those doors open. But here's the catch. High insulin sends a loud signal to your body that says store fat immediately. Now you are trapped in a vicious cycle. Those jammed locks leads to more insulin leads to more fat storage, and more fat storage jams the locks even further. I'm going to show you some small video animation in this slide. So these yellow molecules are glucose and the blue molecules are insulin. So as you can see, the insulin acts like a key. It sits on the insulin receptors, and then it opens these glucose transporters. So all the glucose in your bloodstream can go inside the cell and produce energy. And this is a normal physiological mechanism that happens in everybody. So if you see here, this is what insulin resistance looks like. The green molecules are the glucose molecules, and the blue ones are the insulin molecules. So as you can see, even though the insulin is binding, there is a malfunction of the receptor. So most of the glucose cannot go inside the cell, and that causes more insulin, and then eventually it leads to diabetes, prediabetes and diabetes. And then once the pancreas gets exhausted of secreting insulin, it becomes insulin-dependent diabetes, where the patients have to be on insulin injections for life. Okay, on top of that, we have genetics. Up to 70% of your weight is passed down through your DNA. In fact, if both your parents have obesity, the chance of child inheriting it are around 70 to 80%. If you have ever felt like you were constantly fighting your own body while your friend could eat anything and stay thin, you weren't imagining it. You're biologically truly different from others. But having these genes is not a life sentence. The right lifestyle changes and medication tools work incredibly well, even if it runs in your family. It just means your body needs a different kind of support, and we have that support now. Next, let's go to environment and how it's working against your weight. Your environment is quietly working against you in ways most people never realize. Plastics, BPA, and phthalates found in food packaging and even on grocery store bills can mimic estrogen in your body, disrupts your fat cells behavior. And so what can you do? Simply swap plastics with glass and stainless steel. Stress. Chronic stress doesn't just feel bad. It physically drives fat storage around your belly, fuels cravings for sugar and fat, and blunts how well insulin works. Next is shift work and sleep issues. If you have someone you love works in the night shift, this matters. Shift workers face 2 to 3 times higher risk of obesity because disrupting your body clock throws off the same hunger hormones we have been discussing about. Next is ultra processed food. These ultra processed packaged foods are literally designed in a lab to override your natural fullness signals. You can't avoid every trigger in your environment. I'm not asking you to. But your home environment is something that you can shape. In my home, I keep dates, fruits, and nuts, and that's what my kids reach out for. Proximity drives behavior more than willpower does. Think of this: a water bottle sitting right next to you versus across your room. You tend to take that water more often if it's right next to you compared to somewhere else. So change what's within reach and change what you eat. Now I want to share something that's close to my heart because it's about the next generation. When a mother carries excess weight during pregnancy, It doesn't just affect her, it can shape her child's biology before that child takes the first breath. Children born to mothers with higher BMI are roughly 3 times more likely to develop childhood obesity. And the changes happen inside the womb. Excess nutrients during pregnancy can literally alter how babies' hunger signals and fat storage, and that continues for their life. I share this not to create guilt. I share it because this is one of the most powerful arguments for early action. Treating obesity before pregnancy may be one of the simple and most effective ways to break a cycle of chronic disease before it even starts for the next generation. I'd be willing to bet almost everyone in this room has someone close to them living with at least one of these illnesses: high blood pressure, diabetes, heart disease, sleep apnea, arthritis, fatty liver, kidney failure, or PCOS. We have gotten so used to seeing these conditions that we treat them as separate, unrelated problems that just happens as we get older. But here's what I want you to really sit with. Every single one of these can be a downstream consequence of obesity. And for decades, medicine has been excellent at treating each one of these individually. A pill for diabetes, a pill for blood sugar, referral for joints, without stepping back to ask, what's actually driving all of this? Don't get me wrong, treating individual disease matters, and that's always the right thing to do. But it's equally important to ask what caused it and what can we do to stop more from happening, more disease from following. That's the shift modern obesity medicine represents. And hopeful news, even 5 to 10% of reduction in body weight meaningfully lowers these risks. You don't need to fix everything at once. You just have to start moving in the right direction. Let me make this concrete with a term you may have heard but never fully understood: metabolic syndrome. It's simple, it's a cluster of diagnoses. If you have 3 or more of these 5 things, you qualify: a large waist, over 40 inches in men and 35 inches in women, high triglycerides, low good cholesterol like HDL, and high blood pressure and high fasting blood sugar. 35% of US adults have this. If you have obesity, the odds jump to 60%. Here's why this matters beyond the numbers. Metabolic syndrome is your body's early warning system. It's a signal that says your body is under strain, that things are moving in the wrong direction, and that now, right now, is the exact time to act. Because this stage because at this stage, lifestyle changes alone can be genuinely powerful. This is the point where you can eat right and move and exercise and sleep better and reverse the trend before it becomes something harder to treat. Think of it like a fork in the road. You still have real choices here. Path to being normal is absolutely within reach. This is one of the easiest things to ask your doctor about in your next physical. 5 numbers. If 3 are off, you now have a name of what's going on and a clear, actionable starting point. Here's the number that stopped me the first time I really sat with it. 13 different cancers are now linked to excess weight. Not 1 or 2, 13. Brain, breast, colon, liver, pancreas, and more, as you can see in that image. I'm not sharing this to frighten anyone. I promise no fear tonight. I'm sharing it because it reframes what we're actually doing when we treat obesity. We are not chasing a number on the scale. Maintaining a healthy weight is one of the most powerful things you can do to lower that cancer risk. And that's not a small thing. I want to introduce to you a diagnosis which most people have never heard of, even though it likely affects someone you know. It's called fatty liver, which is an old name, and the new name is MASLD, or metabolic dysfunction associated steatotic liver disease. And it affects 1 in 4 adults worldwide. Most of them don't know they have it. Here's what's happening. Fat builds up in your liver cells, even in people who don't drink alcohol at all. It's closely tied to obesity and insulin resistance, and it has quietly become the leading cause of cirrhosis and liver transplants in this country. The dangerous parts, it has no symptoms until it's advanced. And here's the good news. The liver is remarkably forgiving. If you catch it early, losing just 5 to 10% of your body weight reduces liver fat. losing more than 10% can actually reverse scarring that's already there. The Mediterranean diet is the most evidence-based eating style for this liver health. And there is now an FDA-approved medication for advanced liver disease. If you have obesity or type 2 diabetes, ask your doctor to check your liver enzymes at your next visit. One blood test early detection means your liver can genuinely heal. We have spent a lot of time understanding the why, because this is what drives long-term behavior change. Now let's talk about what we have all been waiting for, lifestyle changes. Let's start with nutrition and what actually helps right on your plate. I want you to picture your plate divided into parts as shown in the image. Half of it is filled with vegetables and fruit, and the quarter with lean protein, and the remaining quarter with whole grains or legumes. And this is what the dietary guidelines of Americans. It's a reverse pyramid where whole foods, fruits and vegetables and protein is in the top of the list. Now here's my favorite tip, because it's completely free, requires no special foods, and the science genuinely surprised me the first time I read. It's not what you eat, it's the order you eat in, the sequence. Vegetables first, then protein and fat, then your starches and carbs in the end. Why does this work? The fiber in vegetables creates a physical barrier in your gut that slows digestion and blunts the blood sugar spike from everything that follows. Eating protein before carbs sends 2 to 3 times more fullness signals to your brain and saves carbs for the last and flattens your blood sugar curve, lowering the fat storage signal your body sends every meal. The research. Eating carbs last can reduce your post-meal blood sugar spike by 40%. No calorie counting, no food elimination, just rearranging the order in which you eat. Let's talk specifically about protein, because it is the most common gap I see in my daily life. Your ideal clinical target is 1 to 1.5 grams per kilogram of protein per day that you can split into 25 to 30 grams of protein per meal. You can go up to 40 grams if you're athletic or do a lot of strength training. At this level, you stay full significantly longer and protect your lean muscle tissue. Protecting muscle is vital because muscle tissue acts as a metabolic engine. It burns calories even when you're sitting completely still. To hit that 25 to 30 grams target, here's what it actually looks like on your plate. If you eat meat, a standard chicken breast gets you about 30 grams of protein, and a can of tuna provides 25 grams. A fillet of salmon can give you 22 grams. If you eat plant-based diet, half a block of tofu foam gives you 20 grams. A single cup of lentils or edamame delivers 18 grams, and a single serving of Greek yogurt can provide 17 to 20 grams. You can add cottage cheese or paneer as well. No matter what your dietary preference looks like, there is a clear path to hitting this target. And let's be entirely honest, there is no single best medical diet. The only diet that truly works is the one that you can actually live with long term. Whether it's Mediterranean, low carb, or plant forward, they can all succeed depending on your unique health profile, preferences, and cultural traditions. If you remember only one rule of thumb from tonight, let it be this. Sustainability always beats strict macronutrient counting. Focus on choosing whole foods over ultra-processed options. Aim for at least 25 to 30 grams of fiber per day and keep yourself well hydrated and try to hit your protein targets every meal, no exception. A roughly 500 kilocalorie per day deficit improves the odds of weight loss, and that's a well-established target by American College of Cardiology. But how do you get there should be built around you, your preferences, and your health conditions. About Mediterranean diet, one major trial found a 30% reduction in cardiovascular risks. Other research showed 40% risk in type 2 diabetes, and in patients who already had a heart attack, a risk reduction of 50 to 70%. So what does Mediterranean diet actually look like? More vegetables, fruits, legumes, and whole grains. Olive oil as your main fat instead of butter. Fish at least twice a week. Nuts as your go-to snack. And less red meat and less ultra-processed food and no sugary drinks. No diet needs to be perfect. Small, consistent changes add up to enormous health improvements over time. Direction matters more than flawless execution. Now I want to talk about something genuinely underrated in the weight management: sleep. Here's what happens after just one bad night. Your hunger hormones rises, your fullness hormones falls, your stress hormones rises and drives fat storage, and your cravings shift towards high calorie, high sugar foods. Remember that day when you didn't sleep for a few days and you woke up with a hungry stomach and growling in your stomach? That's ghrelin. That 3 p.m. crash where you're reaching for something sweet, that's not weakness, it's predictable hormonal biology. People sleeping under 6 hours a night are at 55% more likelihood, have more likelihood to develop obesity. What helps? Aim for 7 to 9 hours of sleep. Keep consistent sleep and wake times, even on the weekends. Avoid screens for at least 30 to 60 minutes before bed. And if you suspect sleep apnea, talk to doctor. And if you're diagnosed, please get it treated. Sleep is an important tool in weight management. It's free and it's one of the most powerful levers we have. Let's talk movement. Excuse me. The national guideline is 150 minutes of moderate intensity activity per week to maintain your weight. In order to lose your weight, you need at least 250 to 300 minutes per week of moderate intensity activity. So let's start with the basic. 150 minutes per week is just over 20 minutes a day of exercise. So what does moderate intensity activity look like? Walking, cycling, swimming, playing tennis, anything that can raise your heart rate. And there's a small talk test you can do to check if you are doing a moderate intensity exercise. So while you're walking, you should be able to talk but not sing. So that's a sign that you're doing, it's a moderate intensity walk. Plus, always add 2 to 3 days of strength training, which looks like weightlifting, resistance bands, and also you can do body weight strength training like push-ups or pull-ups. Always break up long stretches of sitting with short movement breaks. You might have heard the term sitting is the new smoking. So sedentary lifestyle is not good for weight gain. It's not good for weight loss, sorry. The benefits go far beyond weight. Movement improves insulin sensitivity, mood, and sleep. Everything we have talked about tonight is connected. My honest advice, start where you are. Any movement is better than none. You don't need a gym membership or training plan to begin. Here's something that gives people real permission to stop thinking. Exercise only means gym. Now, I'm going to introduce you to a topic called NEAT, non-exercise activity thermogenesis. It is the movement outside the gym. Basically, all the movement in your day-to-day life that isn't formal exercise, like your active chores, parking further away, taking stairs, standing or pacing during phone calls, gardening, moving for 2 to 3 minutes for every 30 minutes you spend sitting. NEAT alone can account for up to 350 extra calories burned per day. That's equivalent of a brisk 45-minute walk without ever setting foot in the gym. So as you can see here, the BMR, which is the basal metabolic rate, is the amount of calories burned at rest. And that's the major part of your metabolism. And then the next thing, the next highest thing that burns your calories is the NEAT. And as you can see, exercise is in the top, and it depends on what kind of exercise and how many calories you burn. But this is something that you can incorporate in your daily living to make sure you have movement, and that can be counting steps, talking to your friend, while walking. So anything that helps to lose weight. A simple framework for exercise this is called exercise prescription. Again, frequency, 5 or more active days a week with exercise, work at a pace where you can talk in sentences, not sing. And that's the intensity, which is moderate intensity. Start with 30 minutes broken into smaller chunks if needed. Mix cardio with strength training at least twice a week. And most importantly, Do something you actually enjoy. Exercise you hate is the exercise you will quit. Enjoyment is the single best predictor whether you will stick with the exercise. Like it could be dance, it could be any active sport like tennis or badminton, it could be martial arts, anything that works for you. That's the single most important predictor if it's going to be sustainable for you. I want to show you the real data from real people who have kept weight off long term because I find it genuinely inspiring. The National Weight Control Registry has tracked over 10,000 people since 1993. To qualify, you had to lose at least 30 pounds and keep it off for at least a year. The average members lost 66 pounds and maintained that weight loss for over 5.5 years. Here's what they actually did. Almost all of them changed what they ate with consistent patterns across the week. 94% increased their activity, and the number one reported exercise was walking, not marathons, walking. 90% ate breakfast daily, 75% weighed themselves weekly, catching small gains before they become large ones, and most watched far less TV than national average. So no more Netflix subscription from now. Just kidding. At 10 years out, these members had maintained over 50 pounds of weight loss on average for a decade. This isn't a miracle, it's a pattern anyone can learn from. A few words on our children, because early action here genuinely lasts a lifetime. Children with obesity are 5 times more likely to carry it into adulthood. The habit set in childhood tends to stick. What parents can do: model healthy eating. Children copy what they see far more than what they are told. Cook at home. Eat together when you can. Keep water and fruit visible instead of juice or packaged snacks. Make movement genuinely fun. For younger children, I want to be really clear. The goal is not weight loss, it's healthy growth as they develop. The focus should always be on the whole family's lifestyle, never on a single child's weight number. For adolescents 12 and up, FDA-approved medications are now an option when clinically appropriate. You can have a conversation with your pediatrician if applicable. We covered science. Now let's talk about how we treat it. Good obesity care starts on 5 pillars. Nutrition, a personalized plan you can sustain, built around your actual life, not generic template. Exercise, starting exactly where you are. Remember the registry? Walking was one of the most common habit of long-term maintainers, not marathon training. So start slow and keep consistent. Medication, FDA-approved treatments that correct the biological drivers we have spent this whole evening discussing about. Behavior change, identifying your personal triggers and building habits that last. And treating root causes, hormones, sleep medication, side effects, mental health issues, food access, all of it. The best plan isn't the most aggressive one or the most popular one. It is the one you can sustain and that looks different for everyone. So there are many lifestyle toolkits that you can use. Your Apple Watch, your Aura Ring, which tracks the sleep. You can use some apps like MyFitnessPal for nutrition. Let's walk through the full spectrum of treatment options available today, because most people have no idea how many options exist beyond just diet and exercise. Lifestyle modification is the foundation for anybody who is either without trying to lose weight without GLP-1 or who is on GLP-1 medication. Nutrition, movement, sleep, behavior change, everything we have covered tonight. Medications, FDA-approved drugs that target hunger, fullness, and metabolism directly. This field has moved faster in the last 5 years than in previous 50 combined. Endoscopic procedures like intragastric balloons, which are minimally invasive, and bariatric surgeries, which can lose up to 35% of weight. This is a spectrum, not a ladder you're forced to climb. Where you start depends on your biology, your health conditions, and your goals. Now, medications. Older options typically achieve 5 to 10% weight loss. Then came GLP-1 class, like Wegovy or semaglutide, Zepbound or tirzepatide, which are injectables weekly, and then oral options like Wegovy oral pill and orforglipron, which is Foundayo. They can all cause 15 to 20% of weight loss. The older medications like phentermine, topiramate, or naltrexone can cause up to 8% weight loss. Now, what is GLP-1 hormone? Everybody keeps talking about GLP-1. It's a hormone that gut releases after eating. It acts on three fronts simultaneously. Signals from the brain that you're full, slows gastric emptying, so calories are absorbed more gradually, and stimulates pancreatic insulin secretion. Now, this is far beyond what GLP-1 receptor agonists or the medications that we use amplify this signal far beyond what the body produces on its own, which is why semaglutide and tirzepatide produces 15 to 20% body weight reduction in trials. And the common side effects are nausea, vomiting, constipation, but the things that you can do to prevent them is to eat less greasy, low-fat food, and then increase more fiber. And rarely it can cause pancreatitis. Contraindications can be medullary carcinoma of thyroid, or contraindication, like we don't usually prescribe these medications to these patients who have medullary carcinoma of thyroid, or pancreatitis, or slowing of the gut, like gastroparesis. Now, on the cost, most of the insurances are starting to cover these medications, but some insurances still don't. So the options can range from $149 a month to can go up to $450 a month if you go through Lilly Direct or Novo Nordisk Pharmacy. Before we close, let me address the myths I hear constantly because they deserve honest answers. Myth is it's the easy way out to take medications. These medications correct real measurable imbalances in hormones and metabolism. The same way insulin corrects diabetes. Nobody calls insulin the easy way out. You only need it until you hit your goal weight. Obesity is a chronic disease. Most patients need ongoing treatment, just like blood pressure medications. Like I said, sometimes these medications give many patients an opportunity for a better lifestyle so they can exercise more and get fit and have these lifestyle modifications. And some patients can be on a very low dose, maintenance dose, after they have better lifestyle. Only people who don't try need medications. Remember metabolic adaptation? Your body actively resists weight loss. These medications give your body a fair chance. And what they do go beyond the weight. One major trial showed GLP-1 medications reduce heart attacks and strokes by 20%. This is real disease prevention, not just a small number on the scale. These medications don't replace lifestyle changes. They make lifestyle changes possible. They work with your biology, finally, instead of against it. Here are the questions worth bringing to your doctor. Do any of my current medication cause weight gain? Could I have sleep apnea or thyroid issues affecting my weight? Am I a candidate for GLP-1 or bariatric surgery? Or if they cannot prescribe weight loss medication, can you refer me to an obesity medicine doctor? Let me close with what it looks like to actually get support, because I want this to feel real and approachable, not abstract. Step one, a comprehensive intake. We map your specific drivers together: hormones, medications, mental health, food access, full history. Step two, a personalized plan: nutrition, medication if appropriate, exercise and behavior strategy built around your biology and your actual life. Step three, regular check-ins, monthly visits where we adjust, troubleshoot your doses, and celebrate your wins. Step four, long-term partnership. Chronic disease needs chronic care. We are in this with you for long haul, not just until you hit the number. We are a hybrid in person and telemedicine only for New Jersey for medical weight loss. And currently we are taking cash and not insurance at this time. Please don't hesitate to call us if you have any questions. So the key takeaways, what you know and what you can do. Know your BMI. General standards, like we discussed, and for Asian population, overweight is more than or equal to 23, and obesity is more than or equal to 27.5. And lifestyle pillars, nutrition, where you can eat more protein and fiber before carbs, that's called nutrition sequencing. Limit ultra-processed food. Exercise every day, at least 20 minutes per day to maintain your weight, and 2 times strength training per week. NEAT or non-exercise movement, walk more, take more stairs, stand at your desk. Daily movement matters as much as workouts. And environment, stock your pantry with healthy options only. You're not alone. Obesity is a medical disease, not a failure of character or willpower. Our treatments work even with strong genetic loading. Ask your doctor for weight management programs and GLP-1 medications if we qualify. So these are the criteria that FDA approved for BMI over more than or equal to 30 for any patient, or BMI more than or equal to 27 with weight-related conditions like diabetes, hypertension, high cholesterol, or sleep apnea. And the medications available, like we discussed, GLP-1s are Wegovy, Zepbound, and liraglutide, which is Saxenda. I'll close with one quote that I really liked from a children's book. Asking for help is one of the bravest things you can do, and the conversation with your doctor could change your life. You came here already thinking differently about health. Now you have a language for conversation you may be putting off. You have clarity about what's actually happening in your body and hope of what can be possible. You don't have to figure this out alone. You were never supposed to. Thank you so much, everybody listening patiently with my presentation. I'm open to any questions.
Thank you so much, Shilpa. It was amazing.
Yeah, thank you.
Really
Thank you,
great
Silpa.
knowledge
Really
and
great. Yeah.
information. Yeah, please. Anybody, any questions? I can ask one question actually.
Sure.
So a lot of people they don't even eat like that much food, and they say that like they are, even without eating too much, they anyways gain the weight. Like it is like their metabolism even not helping, or they try to even lose weight, they can never lose the weight. It is, they say I'm eating everything healthy, everything is good, but still they still have a, like heavy. What is the reason why some people are like that? Like
Yeah.
they're
And that's a very good question, Shraddha. So basically, that's what we were talking about is called metabolic adaptation. Everybody has a set point based on their genetics, based on their environment. And let's say if that person is 150 pounds and they try to lose weight by not eating or by following some extreme diets, what happens is the body thinks it's like a thermostat, right? For the home. So the body thinks, oh, okay, 150 is my set point. This person is trying to lose weight. Let me get them back to the 150 that they were supposed to be at. So what the body does, it increases the hunger hormones. It decreases the metabolism. So they're hungry all the time, tired. Their metabolism is going down. And at the end of the day, without knowing, they're back to 150 pounds. Or let's just say they gained weight or they became 160 pounds or 170. The body tries very hard to lose that weight by increasing their metabolism, by decreasing the hunger hormones. They don't feel hungry. So a lot of biological drivers and this genetics play an important role where every person is different, and that's why we need to do a very clear, thorough evaluation as to what is causing them to, resist weight loss. And that's why going extreme diets can lead to, a rebound weight gain. And my recommendation is always to do whole food, high fiber, high protein diet, like I mentioned, or Mediterranean style of diet, where you're not going in the extreme direction. And with lifestyle modifications, there is a chance of including exercise, the NEAT that I was discussing, daily movement. There is always a chance to lose 5 to 10% if there is intense lifestyle modifications of their body weight. Yeah.
okay. Thank
I
you
have
so
a
much. Yeah,
question.
yeah. Go ahead.
Thanks. Hi, this is Purvi. Thank you so much for the insights. I'm sorry I'm not on video today.
No
Just
problem.
to the question that I have is more on post-menopause. Like, do you have any tips or recommendations on managing weight? I get the hormonal aspect of it, but if you can share some tips, that will be good. The
Yeah.
other related question I have is on intermittent fasting. Do you personally recommend that for your patients? So those are my
Okay.
two questions. Thanks.
Sure, sure. So and that those are two great questions. The first one is about menopause or postmenopause. If you have seen my slides, one of the slides actually mentions that menopause can be or post-pregnancy similar. It's a driver of weight gain, and the tips for postmenopause follows for anybody else, like I mentioned, is trying to be in a calorie deficit of at least 500 kilocalories per day, trying to have more movement in your day-to-day life, trying to have exercise, at least if you want to see active weight loss, for at least 300 minutes. That's the extreme end, but 250 to 300 minutes per week. And there are also hormone replacement therapies that are available from gynecologists or people who have certified, which help you with other things like, mood and everything else, but not much research on if it helps with weight loss. And if despite lifestyle changes, you haven't lost like more than 5% and your BMI is still over 30, GLP-1s are a great option to be on, which will be like a tool to help you lose weight. And as far as the second question is concerned about intermittent fasting, there's not much clinical evidence to support it other than the data, which is showing that when you do intermittent fasting for, like, let's say 14 hours, you're not eating from the night, and then you're eating breakfast late, like say 14 to 18 hours, you're actually kind of forcing yourself to be in a calorie deficit. So it's pretty much similar to that. So there is no like specific data that, oh, you're fasting, so your metabolism is getting better. It's just clinically, the clinical data has shown that if you're intermittent fasting, it's similar to calorie deficit, being in a calorie deficit, because you're not eating as much calories.
Thank you.
Hi, Shilpa. This is
Hi.
Akshita. And I would like to ask you a question.
Sure.
So I see like most of the women, they actually lose weight when they when they are into this weight loss. But what I see is they don't lose the belly fat. So do you have any tips or recommendations? I think
Sure.
this will be helpful for most of the women.
Yes, sure. So what clinical research has shown is the belly fat is usually due to high cortisol or high stress levels. And I know for most of the women that is the case because we are managing from jobs to household to kids and to multiple things that we are doing on a daily basis. So high cortisol is part of our lifestyle. So the one thing I would say is try to reduce your stress levels by doing meditation or mindfulness, using mindfulness techniques. Obviously, losing weight, when you lose weight of 5 to 10%, it also reduces the visceral fat and also belly fat. So losing weight by itself can also help, but obviously, after pregnancy, the core can be weak. And then, in doing more core strengthening exercises, like more sit-ups and, more like core strengthening exercises can really help with belly fat as well. But I think the main foundation would be the stress management, trying to be in a lower stress level so the cortisol doesn't go high. And when the cortisol goes high, the belly fat is the main area that that increases.
Thanks for your recommendation, Shilpa. Yeah.
You're welcome.
Yeah.
Hi,
Hi,
Ashoka. This
Dr.
is
Shilpa.
Dasai and Jim.
Hi,
How you doing?
good. How are you?
All right. Very good information here tonight. Thank you.
You're welcome.
Quick question.
Yes.
What are some of the better apps to help easily track, the quantity of carbs and protein and fats that you intake every day? Is there
Yes.
anything good out there?
So MyFitnessPal has the nutrient tracking, but Jim, I think the most important thing is you can start with that initially, but at the end of the day, it has to be sustainable for you. You know,
Right.
Macronutrient counting is can be hard on day-to-day basis, but I would say sketch out a plan. Obviously, initially those apps will be like a tool to help you to design the diet that you're supposed to be on, but eventually it has to be like sustainable. Your food preference, your cultural preference of food and everything else also adds into it. And your tastes about food and your food choices also matter. So I would say MyFitnessPal is good for tracking your macronutrients. But if you are a non-vegetarian, it's not that hard to hit your protein goals. And just adding more fiber like vegetables and fruits in your every meal will by itself help. And adding nuts and fruits as a snack also will totally help. So try to build something that's more sustainable for you. But I sometimes I used MyFitnessPal initially to kind of help me track what I'm eating, what I'm not, to create the awareness of, how much carbs I'm taking. Ideally, carb count should be less than 45% of your meal.
Hmm. Okay, and second question I have for you
Mhm.
um, pertains to I know everybody's body's like a little bit different. Their metabolism's different, and based on a lot of different factors. Is
Mhm.
there any tests out there that can, like blood tests, or I don't know, whatever, like that can tell you what's what kind of foods are best for you, what kind of foods to avoid as far as allergies, and because some people can tolerate better foods better than other people, and whatever like that.
Yeah, I mean, like clinically, are you talking about like food allergy testing?
All
Or what
incorporated,
foods
like
are better for you? So, I mean, there is no specific recommendation for that kind of a test, but if you have allergies to certain foods or your body isn't tolerating it, an allergy specialist can run those tests as to which food is like more, are you more intolerant to? As far as I would say, just go with your body, see what your body is able to digest and take well, and then again, whole foods, grains, avoid ultra processed foods, and more protein and fiber. That's all like the recommendation for now. But if you have specific food allergies, an allergy specialist can help you with those tests. Yes,
okay, thank you very much.
you're welcome.
Shilpa, if you don't mind, you can
Sure.
close the presentation, then we can see you in the bigger screen.
Okay.
And also, I see a question in the chat box. Somebody's asking, Sudha is asking, do you recommend medications for new moms or how long they have to wait?
Um, for new moms, it depends if you're breastfeeding. I would say most of these medications have not been researched on women who are pregnant and who are breastfeeding actively, due to obviously ethical reasons. And so we don't have data on what's going to happen, or do these medications, go through the breast milk to the children, to their baby or not. So I would say once you stop breastfeeding, that would be the ideal time to get on these medications. If you have tried lifestyle measures for at least 6 months, and then you are not able to lose weight after pregnancy, and your BMI, you're meeting the criteria for obesity, and then you can be qualified for these medications.
Uh, I have one more question here. Is it important to know your biological age and is it recommended to test from time to time?
I mean, clinically, we don't really have to, but what we do is we do a body composition scan, which can be done in any, gyms, or some people do it even outside the gym, like in diagnostic centers. I have that machine where I use that to track my patient's body composition. So what we track is their muscle mass, their fat mass, their visceral fat, which is the fat that is on the organs, which is the most dangerous form of fat. And, and this machine gives us those numbers. So let's say your body fat percentage is more than 35% as a woman, that means you're in excess adiposity. And if your BMI is also over 30, that means you qualify for GLP-1 medications. And that point, when we start you on those medications, we start tracking like every 3 to 4 months, is your muscle mass reducing? Because any form of weight loss, whether you do lifestyle intervention or medications or surgery, when you lose weight, you tend to lose both muscle and fat. So our goal is to prevent muscle loss and to increase the fat loss percentage. So our goal would be ideally to be less than 30% in women and less than 25% in men. And also the waist circumference, right? That's another thing that we track. So ideally by increasing the lean protein diet, high protein diet, and by doing 2 to 3 weeks of strength training, we can actually preserve this lean muscle and reduce only fat percentage. And that's, ideally is what we recommend. And obviously, if you can see that as far as the biological age goes, I'm just speaking with like a common sense that if you are younger, most of them have higher body muscle mass. If you're older, right, the muscle mass goes down. Every year you lose 1 to 3% after 35 of your muscle mass. So what do you do to stay biologically young? You build your muscle. You lift weights, you strength train, you do all of this, and that will help you to preserve your muscle. And also, because muscle is a metabolic organ, it prevents diabetes, right? And most of the sugar is absorbed by the muscle. So I think the best thing that you can do is start 2 to 3 weeks of weightlifting, strength training, resistance band. Everything works progressively, increase your weights. And then, I think that will really help with your biological age as well.
Thank you. Awesome. I think another next is DS. I believe you want to ask the question. Deepti?
Hi Shilpa, this is Deepti. I
Deepti.
have a question about protein intake.
Yes.
It's been so much confusing for me because I heard that you have to take at least 1 gram per kilo weight or something like that.
Yeah.
But every time I increase the protein intake, I'm a vegetarian, so it's really hard for me. I have to have a lot of beans and a lot of things for
Mhm.
me to get to that number.
Yeah.
So
Yeah.
when I am increasing the protein, it's
Mhm.
really upsetting my stomach, and
Mhm.
I'm having really bad days for at least 2 3 days after that. So
Yeah.
then psychologically or like
Yeah.
without any like future like more stress, I just want to cut it off and go back to my thing, like go
Yeah.
back to normal
Yeah.
regime. So
Yeah.
it's really getting hard. So how to know what is the right amount of protein?
Yeah, that's a very good question. Your body is used to some certain type of diet since you were a child, right? So it's and to the adulthood. So suddenly cutting, changing your diet, increasing your protein can upset your stomach or gut, and that's normal. I also experienced that when I was changing my diet, but it's a slow process. I would say start slow, start with, there are so many different lentil options. There's yogurt, Greek yogurt. Start with that and see, and slowly add, maybe chia seeds and hemp seeds to the Greek yogurt. That is like 30 to 40 grams of protein for breakfast. Add, if you're a vegetarian and you eat eggs, that's a great option too. Like eat 2 to 3 eggs a day, right, for breakfast. And that itself, you have hit almost 30 grams per day, 30 grams per meal goal. And as far as the lunch goes, I would say eat more fiber or eat fiber first. That helps to create a little bit of, better digestibility because it's fiber. And then eat protein, like maybe try the chickpeas, or try like one type of protein, not too much that your body can't tolerate. Try start low and then take it slow because sometimes it takes time. I had issue with digesting protein as well in the beginning, but as I made the changes slowly, I saw better results with that instead of, forcing your body to eat. Like I said, sustainability is a big deal. So experiment with different types of proteins that you have as a vegetarian, tofu, paneer, eggs, or, milk, if you can tolerate that. And if you can't hit your protein targets in the beginning, that's all right. But as long as you make consistent efforts, you can always, I would not really recommend, but if you couldn't hit your protein goals, you can try whey protein in as a creamer in your coffee instead of, actual creamer, so that whey protein can give you 25 grams of protein, the meals that you cannot hit. There are other protein shakes that are available. If you cannot get your protein goals with whole foods, that's a temporary option you can try.
Sure. Thanks, Shilpa.
You're welcome.
Jitendra?
Uh,
Please.
Good evening, guys. Shilpa, nice presentation, by the way.
Thank you.
Yeah, I have one quick question regarding the fruit intake. For a person going through weight loss journey, what
Mhm.
fruit do you recommend? And my second question is, should the fruits be taken before lunch, after lunch, or after workout? Like, what is the best time to eat a fruit?
Okay, that's a great question. So basically, if you're not a diabetic, obviously it changes with, people who are diabetic versus who are not diabetics, right? So if you're diabetic, eating a mango can cause a high sugar spike. But eating after lunch would be a better option than eating as a morning snack, because after lunch, that controls the sugar spike when you eat a mango. Um, for somebody who does not have diabetes, you can eat any fruit that you want as a snack, or you can include it as a part of your meal. Like I mentioned in the slide, where there is half of your plate is filled with fruits and vegetables. So any fruit with high fiber, like pear, apple, mango, there is no restriction as to what fruits that you can or cannot eat. Kiwi is a very good source of fiber. So just whatever, if you're not diabetic, eating any kind of fruit is recommended for increased fiber intake, and it's much better than a snack. But I would avoid making fruit juices because that increases the sugar spike, and you're taking the fiber out of the fruit basically, and your body is meant to eat one orange at a time, not 10 in a glass. So if you eat 10 oranges in a glass, that causes a good amount of sugar spike compared to eating one or two oranges with fiber in it. So try to eat more whole foods, more fiber. And if you're diabetics, obviously, you can try to eat something after the food, and that helps too.
Thank you. Thanks a lot.
Welcome.
You. So, one more question, Shilpa,
Sure.
like in a simple language, like how do we calculate our BMI? Like if if you
Sure.
don't have any formula, like is there a simple way
Sure.
to understand?
Yeah. So basically, it is you can have calculators like in your phone or anywhere, but it is your body weight in kilograms divided by your height in meters. So it's kilogram per meter square is the formula. So whatever your body weight is in kilograms, you divide it by your height in meters, not in feet or so, in meters. And then you multiply. It's like kilogram per meter square. And you can just Google BMI calculators and you input your details. It'll give you like what your BMI is.
Thank you. Yeah, this is awesome. So I know you mentioned some of the terms like BMI and some of the other terms as well. So if somebody needs to know like how much exercise they need to do, right? They need to understand their body first, right? How much is not too much, right? And how much food is not too much as well. Is there a simple way to do without too much of calculation and thinking too much? Like if there is some way you can simplify it.
Yeah, I mean, the most of us, even with like joint pains or any other issues, medical issues that we might have, walking is a good form of moderate intensity exercise. So going for a walk where you're walking at a pace where you can talk, but you cannot sing, right? So that's called a talk test. So doing at least 30 minutes of walking a day, you have hit the 150 minutes per week goal. So when you do 150 minutes per week of exercise, which is about 20 minutes per day, you are able to maintain your weight. But if you want to lose weight, then you have to increase it up to 250 to 300 minutes per week, right? So then you can split based on whatever your availability is, you can split the days. Now, there is something called high intensity training, which is HIIT exercises, which are very intense training, and then you rest for a few minutes and then you train. So that's called high intensity training exercises, which you can usually do in CrossFit. So those kind of exercises, to like 1 hour of those exercises for 2 times a week is equivalent to 300 minutes of moderate intensity exercise like cycling, walking, swimming. So it depends on your tolerability. Are you able to physically do that type of exercise? Then 60 minutes in a week, you're good to go, right? But if you're physically not able to do and walking is your best form, go for it. You have to enjoy the exercise, and that's the most important part for sustainability. If you don't enjoy your exercise, then ideally you will not follow it and you won't do it. So whatever you enjoy, go ahead and do it. Even if it's dance, music, even if it's martial arts, or even if it means you're playing a sport, you're swimming, doesn't matter. See the exercises that you enjoy the most and start with that, because then you will start building on that success because you already hit the target of starting the exercise because you love it, right? Even if it's playing pickleball or tennis or shuttle badminton, whatever that might be.
Yeah, thank you. Anybody else?
I have one question. So, so I would like to ask that I have heard this technique that as per your body weight or your age, you have to consume specific amount of calories per day.
Mhm,
And then,
mhm.
as you were saying, that specific amount of exercise. If you want to lose weight, if you want to maintain, there is another way.
Mhm.
So, how do we calculate that? Like, how, because mostly the adult size portion is considered as 2000 calories, but sometimes that's also more when you have to lose weight. You cannot have those whole
Yeah,
200. So,
that's right. Yes.
what will you guide here?
That's a good question. So ideally 1800 to 2500 calories for women. And then obviously exercise. Maintaining the easiest way is to maintain at least 500 calorie deficit, right? That means you're burning more 500 calories more than you're eating. So if you're in that 500 kilocalories deficit, you will definitely lose weight. So I would say, calorie counting is good initially to begin with, to kind of see how many calories you're taking in per day. Let's say you're taking 3,000 or more than that. Obviously, cutting down will help, but that's not something, you can do every day. Once you are aware of how many calories you're taking and how many calories that you should take, and you have a diet plan, following that would be enough as long as you incorporate the NEAT I was talking about, which can burn up to 350 calories per day, like a lot of movement during the day. If you are working as a software professional or IT professional sitting on doing a desk job, then having a standing desk will really help, right? You're standing most of the time, or having a under the table treadmill will help. Or if you can't have all those like standing desk and under the table treadmill, then at least getting up and walking for a few minutes, like 2 to 3 minutes every 30 minutes, taking a 2 to 3 minute break where you're just walking or pacing or doing, squats or whatever that is, a movement will help. So that NEAT itself, which is not exercise, will help you burn more calories than exercise itself. And adding exercise and this non-exercise movement and a proper diet, not excess calories, high protein, high fiber, all these things add up. And then, you see the results. So of course, this can be very overwhelming to add everything together, but starting one thing at a time is also a good idea, and incorporating, changes, one change at a time, it also helps, or working with your friend as a community also helps. Yeah,
Thank you.
welcome.
Thank you, Shilpa. I have one more question. So one of my
Sure.
friend, her
Mhm.
daughters are so thin. She's
Yeah.
doing, she wants to let her gain some weight or trying to eat more food, but she's not
Mhm.
hungry, so she doesn't eat enough. Even
Mhm.
though she tries so much, but she never gained weight. She gets happy if she gain 1 kilo, in fact.
Yeah.
So what is like, how can she gain the weight if somebody's trying to gain the weight?
So depends on the age, right? If obviously, and also has to be evaluated by a pediatrician if it's a kid under 18, because there are many eating disorders like anorexia. Are they intentionally not eating? Does she not have appetite? Is there other issue like high thyroid, like hyperthyroid hormones? You have no appetite, right? So this has to be like medically evaluated. Are you underweight and malnourished because you're not eating well? So there is no right answer because she has to be like detailed, there has to be detailed history, evaluation. Why is she not eating? Because she doesn't have appetite, or is it the food that she doesn't like? Or is it like the body image issue, which most of the teenagers can go through, right? So the psychological evaluation, evaluating medically, does she have any thyroid issues or PCOS or anything that can be causing her not to eat. All these things are important and has to be validated by a physician.
Mhm. Yeah, that makes sense. She's around 22 or something. So, she tried everything, but, she tried to get the nutrition plan as well, but it never
Yeah.
works for her, I guess. So,
Yeah, I think they have to kind of talk to her doctor and see what could be the cause of if she's falls under 18.5 BMI, then she could be malnourished. And is she eating less than 800 calories, then it can be kind of, she'll be deficient in a lot of nutrients and electrolytes can be imbalanced and, and that needs to be taken care of. Yeah.
I would like to add to this question. My son
Mm.
is only like 10, 11 years old and he's 19 BMI. So
Mm.
I am really worried. Like, I have tried all sorts. I give him very high nutritious food and cook at home, very little junk. But
Mm.
since birth to up to maybe 4 or 5 years, he was okay. But
Mhm.
since then, 5 to 10, 11, he's like lean. And if it feels as if we
Yeah.
make a joke like a shirt is hanging to a hanger, you look like that. So I don't know how much more should I do, because I give him uh, I know I cook every day, so I know I'm giving him as much as I can, but
Mm.
he doesn't put on weight. But he's not like a kid who doesn't eat. He's eating
Yeah,
like a
I
good
mean,
amount.
yeah. That I mean, for children, as long as they're eating right and they're growing, some kids grow taller until, 18, and they might be burning more calories by being very active, So they might be burning more calories than they're eating. So that's all right, as long as they're eating healthy, and they are, their weight is within the normal range. I don't think you should be worried. I know in Indian culture, we kind of tend to prioritize and push for a high nutritious and more calorie diet. But again, childhood obesity is a big epidemic that's starting in India because of the lifestyle and highly processed foods that we millennials did not experience. So I think as long as he's eating healthy, he's exercising, he has good activity and less screen time, he should be good.
Okay, so you mean the BMI number doesn't I don't have to worry about it.
Yeah, as long as the pediatrician is checking, again, the higher BMIs, like somebody, a child is more than 30, and they have diabetes or hypertension, which my friend who's a pediatrician in India has been experiencing, and she's talking to me about this recently. That's alarming, right? That needs medical attention. But for a child who has normal BMI, who's eating healthy, who's actually growing, most of the children who are very active, they grow taller. So most of their calorie deficit is because of their activity if they are highly active. So as long as their BMI is normal and they're eating healthy, good amount of protein and fiber, I think you're good. But talk to your
Okay, thank you.
pediatrician, just make sure, like in the yearly visits, make sure his BMI is good, and that's pretty much it. Yeah.
Okay, thanks.
Can I ask a parallel question to this?
Sure.
Because even I have a 3-year-old toddler, and I can
Mhm.
relate with this because she's also very thin, but she has that tendency coming from her father's side that they are all tall and lean.
Mhm.
And the BMI is always not like, but like, doctor, do you think that
Mhm.
this BMI thing is a bit misguiding because it's as per the WHO ratio and it's considering the people overall the world, and
Yeah.
the genetics play an important role here. And also like, I feel that Indian kids, like, we have
Mhm.
different genes.
Yeah.
So like, it's not only few but many of my friends, Indian friends, have kids and everyone's BMI is low. like it's 5%, and so is this a bit misguiding parents and making us worry more, or what do you think? Because
Yeah.
yeah, yeah.
Yeah, because like I mentioned in one of the slides, for Asian populations, our overweight and obesity BMI is different, right? It is actually 25 is considered like overweight, 23 is overweight, and more than 25 is considered obese. So the BMI can be misleading, but as long as the child is, for Asian populations tend to be leaner because of our genetics, right? And that's all right as long as they're eating healthy, they're growing, right? The growth percentile chart that your pediatrician will follow every year, annual visits, as long as it's not alarming and they're, not having nutrition deficiencies and all this, I think you should be good. Most of the Indian parents have the tendency to kind of feed more until they're full because the fullness signals are important. When a child or even as adults, we are full, that's a brain sending, a gut sending a signal to brain to stop eating. And if we are kind of bypassing that in childhood, obviously that can, lead to obesity when they grow old. So I would say the best thing for that, although I'm not a pediatrician, but based on obesity medicine guidelines, is less screen time when they're eating so they can listen to their gut brain signals, and having them eat, not us feeding them, is an other important tip that you can use. Because when you eat with your own hand, you know how much like full you are. And as long as they're growing healthy, they're within, the normal BMI range and the growth percentile chart, I think that should be good. Yeah.
Yeah, that makes sense. I remember my son, he was so active, and I used to go to the doctor that he is, no, he's always like so thin. The doctor said the same thing. As long as he's active, he is not tired and, like, you know, kind of behaving as a child, what he's supposed to do. And yeah, okay.
And we recommend at least 60 minutes of like vigorous activity for like children from 10 to 14 and above, and at least 60 minutes of activity for any toddler, and less than 1 hour of screen, 1 to 2 hours of screen time starting ages 4. And below age 4, the recommendation is zero screen time. FaceTime is fine with families and friends, but zero screen time is what is recommended.
Thank you. Yeah, that's a very, good information.
You're welcome. Thank you. Any more questions?
I was a bit late for this because of my office, but I just wanted to check, did we already consider the intermittent fasting topic, or we already
Um,
discussed? Then I can just watch the recording, but if we did not, then yes.
yeah, so intermittent fasting is, there is not much clinical evidence and data that it's better than calorie deficit diet. Because technically what you're doing is you're not eating for a certain amount of time. You're driving your body to be in a calorie deficit, right? Calorie deficit also have similar results as intermittent fasting. I know like in social media and a lot of other like wellness gurus promote intermittent fasting, but you can still do it if that's the way that is, helping you to be in a calorie deficit. Go ahead and do it. I
Mhm.
don't see any harm as long as you're not on any medications like insulin or, or diabetic medications. Um, and your body's tolerating that well, sure. But if you, I don't know if you have seen the National Control Registry slide where most of them had breakfast who maintained their weight loss. 78% of them had daily breakfast, right? If you're skipping breakfast, now that may not be good for you. It can release cortisol in some people. So, so it depends on individual to individual. But it can put you
Mhm.
in calorie deficit if you're not eating for 14 to 18 hours a day. Yes.
Okay, thank you. Yeah, sounds good.
Anybody else? More questions? But we anyways going to provide this recording and Shilpa's information for anybody who wants to reach out and any help they
Sure.
need, any questions they have, definitely you can directly reach out to Shilpa. She is always our in-house, doctor.
Yeah,
She
you can
worked with
call
us
me
as
for a
well.
free consultation, like a free 15-minute consult to see if you have questions, if you want to try, and if you're hesitant, you can call me at the number in the slide, and then I'll be happy to answer your questions and, and get you in if you qualify and you are interested. Yeah.
Awesome. If we are all good and nobody has any more questions, we can close it. It's already 10:30, I believe.
Yeah.
So
Thank you,
thank
everyone.
thank you